Hello everyone, we are the Mangrove team and our policy is on diabetic foot care. Through this PowerPoint presentation, we're going to go through what we know, what the problem is, what it causes, and most importantly, what is the solution. So what do we know? We know that diabetes is a huge financial burden on healthcare. In 2017 alone, diabetes cost $327 billion in the United States. So what do we know? That diabetes affects almost 10% of the U.S. population. If you know an average of 30 people, that means 30 people that you know are affected by diabetes. Diabetes has many complications. One of the ones we're going to be talking about is neuropathy, which is nerve damage, mostly in the feet and the hands. We're going to be talking about the feet in regards to diabetic foot care. Neuropathy is the leading cause of amputation in the United States and almost 30% of that total cost of diabetes. In 2014, there were almost 108,000 diabetics that underwent amputations. That means 108,000 people that had to learn to live without one of their legs, completely transforming their lives. So what do we know? Well, diabetic shoes help protect those vulnerable feet and decrease amputations in high-risk individuals. Imagine what a lifestyle improvement that would be to not have to have an amputation. Diabetic shoes, they prevent calluses. They have an extra wide toe box. They promote blood circulation because they're measured precisely for each patient. They also have advanced level of comfort, better stability by properly distributing their weight. They absorb pressure, help fight fatigue in the feet and legs. Imagine you're a diabetic that has to stand all day for their job like a cashier. These can make a world of difference in your quality of life. They also provide pain relief, quality material that supports the weight. And most importantly, they prevent skin breakdown. There's no internal seams on them, so they reduce the risk of skin breakdown. And when a diabetic gets skin breakdown, they're more vulnerable to infection, which could lead to gangrene, which could lead to amputations. So what's the problem? Why can't we get all these diabetics the footwear they need? Well, Medicare will reimburse for diabetic shoes, but they have restrictions. Only a physician, an MD, can certify that a Medicare patient needs diabetic shoes. Medicare patients will not let a nurse practitioner certify their patient needs diabetic shoes. That patient has to see a physician for their certification. Now keep in mind, nurse practitioners are more than capable of providing diabetic care and assessing diabetic foot exams. Medicare is the only insurance provider to restrict nurse practitioners from certifying and overseeing diabetic shoes. There are almost 224,000 nurse practitioners that are Medicare providers who provide primary care to the diabetic patients. And even though they provide the primary care, those patients must go to see a physician for certification and continue seeing them for their diabetic care if they get shoes. What does this cause? Extra visits for these patients. Most of these diabetic patients are at a point where they can't get around very well, and they're having to come back for extra visits. Think of the quality of life for that. Delays in treatments. This could delay months or even years getting the footwear that they need that's going to improve their quality of life. And it also increased complexity of care, which leads to poorer outcomes. If they're having to wait longer for the diabetic shoes and diabetic care, that means they're also going to be declining health. So what's the solution? Pass the Promoting Access to Diabetic Shoes Act. This allows these nurse practitioners that have been taking wonderful care of these diabetic patients to be able to certify their patients need diabetic shoes without requiring them to see a physician. So one of our teammates, Clay, nurse practitioner, saw a patient not too long ago, and he had been treating him for diabetic care. The patient was an elderly diabetic gentleman with thickened toenails, calluses, flat feet, and diminished pulses with ingrown toenails. He had been seeing podiatry, and they were attempting to get diabetic shoes based on the recommendations and documentation of podiatrists and Clay's physical exam. But lo and behold, it was rejected. Now, they've been having the collaborating physician sign the notes, but learning this is not legal. So the patient still does not have the shoes, scheduled to see the collaborating physician in a couple weeks to have the feet inspected. So even when they go and have the feet inspected in a couple weeks, there's no telling after that how long it's going to be to get approved to get those shoes. This patient could have already had the shoes had Clay, a nurse practitioner who is perfectly capable of doing this, had been allowed to order the shoes. This man's quality of life could have been greatly already improved, but because this is not passed yet, it's not. Thank you for listening, and these are our references.